Welcome back to the Men's Hub. We're going to be talking about cholesterol management. So what is cholesterol? Well, it's a type of lipid or fat that is essential for the body's normal functioning, and it helps form cell membranes, produces hormones, and assists in the creation of vitamin D. However, when cholesterol levels become too high, particularly LDL, this is low density lipoprotein or cholesterol, is often referred to as the bad cholesterol, and it can increase the risk of cardiovascular diseases such as atherosclerosis, heart attack, and stroke. Now, cholesterol becomes problematic whenever you have too much of this LDL cholesterol circulating in your bloodstream. It will build up on the walls of the arteries, forming plaques. And these plaques can narrow the arteries, restricting blood flow, or they can break loose, forming clots that can cause heart attacks or strokes. On the other hand, high-density lipoprotein, this is HDL or good cholesterol, helps to remove excess cholesterol from the bloodstream. So a treatment objective for somebody that has high cholesterol, you want to lower the LDL, you want to increase the HDL, you want to support heart health, and you want to promote healthy lifestyle changes. So that encourages dietary and lifestyle modifications to maintain cholesterol at a healthy level. Orthodox medication is almost certainly going to mean statins, and statins are the most commonly prescribed medications for lowering LDL cholesterol by inhibiting an enzyme involved in cholesterol production in the liver. You might also be given ezetimibe, which reduces cholesterol absorption in the intestines. You might be given PCSK9 inhibitors, which are injectable drugs that help the liver remove more LDL from the blood. Bile acid sequestrants, medications that help to lower cholesterol by binding the bile acids in the intestines, prompting the liver to use more cholesterol to replace the lost bile. You might have fibrates to help lower triglyceride levels and moderately increase HDL. And you might be given niacin, which is a B3, and it can be effective in lowering LDL and raising HDL levels, though it's not always well tolerated by people. Herbal medicine offers several approaches to managing cholesterol levels, focusing on lowering the LDL and raising the HDL, improving circulation, and supporting liver function for better cholesterol metabolism. First of all, the cholesterol-lowering herbs. Sayonara is artichoke. And artichoke is known for hypolipidemic properties. So this is by increasing and enhancing the amount of bile production, improving fat digestion, it can help lower LDL cholesterol. Commiphora guggul, this is myrrh, is a resin that has been traditionally used to lower cholesterol and triglyceride levels. Just be careful with the dosage and for how long you're taking it. Fenugreek can lower cholesterol by enhancing bile production and reduce cholesterol absorption. Philanthus imblica, which is Indian gooseberry, is rich in antioxidants and helps to reduce cholesterol levels by promoting liver health. Polygonum capsidatum is Japanese knotweed, and it's known for its resveratrol content, which supports cardiovascular health and improves cholesterol levels. And then milk thistle, which supports liver function, helping to process cholesterol more efficiently. Now, garlic and cholesterol, it's the allicin dilemma. So garlic is widely believed to lower cholesterol levels and blood pressure. The key compound of these effects is a constituent called allicin, which forms when garlic is crushed or chopped. However, garlic supplements often fail to deliver allicin due to the following issues. If there is insufficient alliinase activity, alliinase is the enzyme that converts allin to allicin. Many garlic products have low alliinase activity, leading to poor allicin production. So in other words, it says it's got garlic in it. It does have garlic in it, but it doesn't have the right type of garlic with the right constituent in it, and therefore is not going to do you any good at all. You might come into problems with the capsule coating, so enteric-coating problems. The enteric coating of garlic supplements is critical, as it needs to resist the stomach acid but be quickly released of its contents in the small intestine. So you need to have capsules that are enteric coated. Lastly, there's fillers and binders that are often put in garlic supplements and inhibit alliinase activity, further reducing the allicin formation. And that explains why some studies show inconsistent results about garlic on cholesterol. It does work, I'm convinced that it works, but it won't work if you get a bad extract or a bad supplement. Another supplement that might be useful for cholesterol is turmeric, which contains curcumin. It's a potent anti-inflammatory and it can help relieve oxidative stress and inflammation, contributing to better cholesterol and metabolism. Capsicum, really wonderful at promoting circulation and can support fat metabolism. Burdock is a lymphatic to help cleanse the blood and support the liver, which is essential for cholesterol regulation. Dandelion root supports liver function, bile function, and cholesterol metabolism. Scutellaria bicalensis, this is Chinese skullcap, which promotes the activity of liver enzymes and promotes cholesterol. And then fenugreek, which is rich in soluble fiber and helps bind cholesterol in the digestive system to promote its excretion. I've included, as part of this session, a handout with lots of recipes of mixes that you can take and food recipes that you can take to help lower your cholesterol, which hopefully you'll find useful. It's also worthwhile spending a little bit of time looking at the video on cardiovascular disease, atherosclerosis, hypertension, and diabetes, because a lot of the recommendations overlap, and these all facilitate most of the core foundations that are deleterious to men's health. That's it for now. Hopefully you find that useful.